Hello, my name is Lars and I'm Director for Partnerships for the Elizabeth Blackwell Institute for Health Research at the University of Bristol. I'm also the Director for Enterprise and Translation at the West of England Academic Health Sciences Network, which is a part of the NHS. I'm sorry I can't be with you today. I had intended to come to Korea for this presentation, but unfortunately I've injured my leg, and therefore I've been told it'd be better if I didn't travel. Hopefully in the future I'll be able to come over and visit you and discuss collaboration with you more directly. But through this video presentation, what I'd like to do is to tell you a little bit about what Bristol can bring to this UK-Korea Alliance for Medical Research. I'd like to talk to you about the challenge of translating research across borders to meet the challenge of healthy aging and independent living. Clearly, we have some challenges coming ahead in healthcare. Currently, we're spending about 9% of our GDP on healthcare across Europe. And if we do nothing else other than carry on doing exactly what we're doing, these costs will rise to above 16% by about 2020. So that means that our health and social care systems are going to face huge challenges trying to meet the expectations that are placed on those resources. So what we need to do is, at the same time as we try and reduce the costs of delivering healthcare, we have to improve the efficiency with which we deliver it. And to me that means one thing, and that means innovation. Innovation requires increased research. So you recognize this fellow, a fellow countryman of yours. In a recent report that he put out under the auspices of the United Nations, he talked about the sharp increase in life expectancy, as though life expectancy was a disease. I like that. But clearly what's been happening is we have a huge growth in our aged population. There are already more people over 60 than under 16, and by 2025 there will be more over 60 than under 25. So accompanied with this is a huge shift in the disease burden. And this means lifestyle-related illnesses are going to become increasingly important. So things like diabetes and obesity and cardiovascular disorders increasing with age. And neurodegenerative diseases in particular are going to be a major burden on our healthcare system going forward. The picture is not static. If we take Alzheimer's disease as a form of dementia, for example, the number of people with Alzheimer's disease has more than doubled since 1980. By 2050, this could increase by 2 to 3-fold. Already about half of the people over 85 have some form of dementia. Currently, this costs about 1.25% of our GDP, and this is estimated to rise by anything up to 3-fold by 2050 on current spending levels. So you can imagine this will account for probably the majority of the healthcare budget in the UK. So we can't ignore this. This is something we have to deal with. Now, clearly one thing that's needed is more research. We've done a lot already in trying to understand this disorder, but we don't really know what causes it definitively, and we can't detect it until it's too late. There are currently no effective treatments. The picture on the left is my uncle who had Alzheimer's disease, the way I'd like to remember him, not the way that he became unable to recognize me or any of his family, and unable to function at all. In a recent editorial in Nature Reviews Drug Discovery, it was concluded that probably the majority of current drug trials in Alzheimer's disease are likely to find it difficult to succeed on the grounds that we do not really understand the biology at which they're aimed at targeting. So an increased understanding of disease mechanisms and the relevance of those mechanisms to the outcomes that we're looking for in drug research is essential if we're going to succeed in treating this disorder. Clearly there's a need for early detection. It's really not a lot of use detecting it at the symptomatic stage if we want to modify the course of disease. It becomes much more difficult to reverse any damage that's been occurred. But detecting it in the mild preclinical stages is clearly very important. So the search for biomarkers and early clues for what's going on is tremendously important. And I'd like to show you one example that we've been involved in, along with our colleagues at Cardiff University. So really, for the first time in 15, 20 years, we've discovered a new set of genes that are linked causally to Alzheimer's disease, or we believe causally. The important thing that I'd like to emphasize is that this research involves over 20 institutions. 16,000 individuals donated samples for this research. And on this particular paper, close to 110 researchers were cited as having played an equal contribution towards this. So the point is to have impact and to find the difficult things that one needs to do in these disorders requires cooperation, I believe, on an international scale. So what can Bristol bring to meet this challenge of healthy aging and independent living? Well, I'd like to tell you a few things about the region first. It's a rapidly growing region. Our economy is growing quite quickly. We have the second highest GDP per capita outside London, so we're one of the most productive regions in the UK. And most of what we have now are knowledge-based industries. Very well known as the second largest cluster of silicon engineering companies outside Silicon Valley. A lot of what they do is aerospace. However, quite a lot is being axed on medical technology, so it's something that we're becoming increasingly known for in our region. We do also have some sheep. I can't resist the temptation to show you these sheep, which are electronic sheep, and we also export them. We're the home of the creative industry as well in the UK. So some of the things that we can bring to this challenge, we do a lot with user participation. The people in our region are actively involved in research, and I'm going to give you some examples of that. We have very good examples of how we use people's input into designing new aids, new technology, new systems. So co-design, co-creation is something that we do a lot. We're very well experienced in these things. And we have a very active research base across the whole of the region. You've heard about our neuroscience, or you will hear about our neuroscience. So we're very strong in neuroscience, as you know, in the basic sciences, but also in population health. We probably know more, have more data on our population, our region, than pretty much anyone else does. And I'm going to show you an example or two of that in a minute. We're also becoming well known in the sensing, detection, and in communications technologies. So anything around telehealth, monitoring, assisted living technologies are things that we want to expand in our region. So we are actively looking for cooperation in that area. I happen also to chair the health sector group of the Local Enterprise Partnership, which is one of the ways that we're supporting businesses in the region. And we are very keen to explore any collaboration in that space. I'd like to tell you about Sphere, first of all, which is a project which was recently launched by EPSRC. It's a national flagship project for sensor platforms for healthcare in a residential environment. If we're going to keep people at home, we need to have technology that will help us and help them to live independent lives. This is a partnership between 3 universities, the City Council, and a number of companies. It was recently launched last year. There are about 50 academics working together to look at how you do smart metering, how you use video, how you use sensor technology in the home, how you measure temperature, wearable devices, and how you fuse all this data to try and understand patterns of behavior and try and understand deviations from patterns of behavior. So can we detect falls, for example? Can we detect when people are not doing the things that they would normally do in their home? And what do we do with that information? How do we link it into the healthcare system so that people can actually react in an appropriate way? I'd like to talk a little bit now about our population and research participation. ALSPAC is a living lab concept. It's been going on for over 20 years. We have 16,000 participants, and all of these participants have donated biosamples and donated data about their lifestyle, their conditions, which has now formed a huge bank of data. It allows us a unique ability to link genetic information to disease, and particularly look at longitudinal cohorts. The original idea was to take samples from mothers and babies in the maternity wards. And for 20 years we've been doing that, and people have coming back every year to tell us what's happening in their lives and to donate information, fill out questionnaires about their lifestyle and any medical conditions that they have, and donate further samples and participate in research. Now, of course, some of the children that were born over 20 years ago are now having their own children, so we're into the 3rd generation of these. And the MRC has seen this as a national resource, and last year invested £23 million into turning this into a major MRC unit. So some people call this building a bank of life. It's trying to understand our population and what the disease patterns are in there and linking it back to any kind of omics that you like. So I think this is a unique resource, and I can see us coupling this quite nicely now to the sort of assisted living technology that I was talking about earlier. So understanding our population, understanding how they react, and getting them to participate in research is a key thing for us. We're also very strong in neurosciences. I'm not going to belabor this point because I think you've had some descriptions of that already. We have an Institute for Clinical Neurosciences. Our functional neurosurgery is well known throughout the world. The Southwest Dementia Brain Bank is located there. The Center for Synaptic Plasticity, you've heard from Professor Cho on some of the world-leading work that they're doing there. We have some young groups around neurodynamics who are looking at circuitry and optogenetics and all these kind of things. So essentially a good group of healthy young people coming into the stream. Our psychopharmacology group is very well known. We have our own clinical research and imaging center that allows us to do a number of tests on patients over time. And we have a good track record of working with industry as well. And some of the models that we've developed, translational models, are really unique to Bristol. And we would like to use those a little bit more in the research that we do. Some of the other things that we do in Bristol that we're well known for ophthalmology. We have a biomedical research center, an NHR funded one, along with Moorfields Eye Hospital there. Bristol Heart Institute, cardiovascular is a strong feature of Bristol, as is nutrition. We also have strengths in robotics and in material sciences and nano science in particular. And we have the Elizabeth Blackwell Institute and the West of England Academic Health Sciences Network, both of which I belong to, that can act as support groups and umbrella groups to make sure that any partnerships that you do access the right people in our network. I'd like to spend just 1 minute talking about the Academic Health Sciences Networks, because this is really how we connect to industry and also to our healthcare practitioners. Now, you will have heard about Academic Health Sciences Networks, licensed by the NHS for 5 years. I'm in charge of the enterprise stream, in other words, how we link to industry. And we also link through that to our universities, and particularly to our health practitioners. And what we do with the Academic Health Sciences Network is work out what our local priorities are with our healthcare practitioners, and are able to reflect that back to research and back to what it is that we would like to see partnerships in from industry. And I've told you some of the things that we are interested in around that. So I think what we're all trying to do is to build this innovation ecosystem, as people call it. And to solve these big challenges, we know that the expertise is not going to be linked to a single group and not going to reside in a single organization. And these types of alliances don't arise by spontaneous generation. We have to make them happen. So linking university, industry, clinical practice, and the community is essential to solving these problems. Many groups need to interact. They have many different cultures, they're motivated by different things, they have different incentives, they work to different timescales, they speak different languages in many cases. So we need to have alliances to bring this together. So I'm very proud to be here today to talk to you about this. So I've put up a graph now, which is a sort of a crosshairs, which is really my philosophy and why I think today is very important, and why we need international collaboration in health research. Currently, our universities are mostly built around individual expertise. They tend to be competitive and highly focused, which is very good for pursuing research. But to tackle big problems now, what we tend to do is to concentrate this expertise in research centers. And that's okay. That provides a level of interdisciplinarity and more collaborative work. But if we want to be truly multidisciplinary and truly collaborative, the only way to do that is to leverage the expertise across a much broader range. And that to me means de facto international collaboration. So I'm very pleased that we're here today talking about this, and I hope that we can get some very good collaboration going with you in Korea around this. This is just a very quick slide to show how this has increased and why this is an increasing trend. So it's some dots that join the different collaborating countries across Europe, comparing 1996 to 2000 to 2004, 2008. And the strength of each line indicates the level of collaboration, and the connections, as you can see, are multiplying. So we've become much more collaborative. And I think that's been good for us. If we look at the bottom part of the graph, you can see that we have the most productive research in the UK in the sense of research output. So if we look at the number of citations per capita or the amount that we spend on research, we outperform any other country in the world. We're currently somewhere around about 3 times as competitive as the United States in that sense, which means that their research, while undoubtedly of greater volume, and we could argue of more significance, the amount that they spend on it is very much higher than the UK. So I think we're small but excellent is the point that I would like to put to you. And I would think that's also true of Korea. So I'd like to just finish off by saying that I think if we build on each other's strengths, we're all going to see further where we're going. And thank you very much for your time. Apologies again for not being able to be with you today.